I'm Dr. David Neskey. I'm one of the founding members of the Head and Neck Specialists. So I take care of patients who have tumors essentially of the mouth and the throat, along with the salivary gland and thyroid disease. They're not only a wonderful group of people that you first meet, they're inspiring about what they're able to get through their treatment. The amount of faith and trust that they have in us and me to take care of them, to get them through that, although can be taxing, is really something that's really invigorating, and you take a lot of pride in that. I think the people that I get to work with that sort of support that process and really support the patients and the families through the whole thing. You know, we always get the credit as the physicians, but there's 50, 60 people in the background that are actually going through and making sure all the T's are crossed and the I's are dotted. My research has evolved over the time that I've been here. Initially, I was much more of what we call a basic researcher, so kind of what you'd think of it, like sitting at a bench and pipetting and doing those sorts of things and running kind of interesting experiments, but not experiments that were directly relatable back to the patient I'd see at clinic. And then over the course of the last 7 years, it's really evolved into more of a clinical trials focus, so basically enrolling patients into new therapies and then looking at why those therapies work or don't work using the resources that the patients provide. So it's a much more what we call translational, meaning translates from the bench, the science, back into the patient.